Evening everyone. How are you? Hope you all are doing good. I'm Dr. Ami Rawal, your original guru for dental anatomy and dental histology. So from today we will be starting our dental anatomy and dental histology lecture. We will cover all the important topics for both DA and DH, right? So today we will be starting with the most important topic of dental histology, which is most basic topic as well, and which is important from your NEET as well as INI-CET point of view, as well as your university exams. So I think most of the students have joined, right? Bindu, Riya, Shweta, Dr. Ruchira, Divya, Tanvi. So very good evening everyone. So which is the most important topic of DH? Tooth development, right? So in tooth development, what we will discuss? We all know that hard and soft tissues of tooth. Which are the hard and soft tissues of tooth? Enamel, dentin, cementum. These are the hard tissues of the tooth. And the pulp, which is the soft tissue, surrounding structures like PDL, alveolar bone. This constitute the tooth as well as our supporting structures. So we all know that where these tissues arise from, right? So basically in tooth development, we will study the formation of this hard as well as soft tissues, right? So which structures are involved in the formation of these tissues? Starting with tooth development. What is tooth development? Odontogenesis, right? Tooth development is mainly odontogenesis. Odonto meaning tooth, genesis meaning formation, right? Genesis meaning formation. So formation of tooth, which includes both hard and soft structures. So all the dental tissues are derived from neural crest cells. They are derived from neural crest cells. Neural crest cells. Except enamel. All the tissues are derived from which cells? Neural crest cells. Except our enamel. Except enamel. Why? Because enamel is mainly an ectodermally derived structure, while rest of the tissues are ectomesenchymally derived structures. These neural crest cells mainly constitute ectomesenchyme, connective tissue, right? Ectomesenchyme. So neural crest cells are mainly present in ectomesenchyme, connective tissue portion. So all the dental tissues are derived from neural crest cells except enamel. This is again an important MCQ question, right? Now in tooth development, mainly we have two structures which are involved in the formation of tooth. One is epithelium and one is connective tissue. That is our oral ectoderm. Epithelium is ectodermal portion and one is connective tissue portion, right? So here we have our epithelium. 2 to 3 cell layer stratified squamous epithelium is present, right? This is our ectodermal portion, epithelial portion, and just beneath this epithelium we have our connective tissue portion, right? This connective tissue portion is what? ectomesenchyme. So this is ectoderm and this is ectomesenchyme. So mainly these two structures are involved in the formation of tooth, right? Ectoderm and ectomesenchyme. Ectoderm is our epithelial portion and beneath this we have connective tissue portion, that is ectomesenchyme. In this ectomesenchyme we have neural crest cells. Due to the proliferation of this neural crest cells, we have our ectomesenchymal portion. And interaction between this ectoderm and ectomesenchyme leads to further tooth development. So basically ectoderm, interaction between ectoderm and ectomesenchyme leads to tooth development. Now how these neural crest cells are formed, right? An embryo question. Head end of the embryo has a thickened neural plate, right? This is head end of the embryo. It is a thickened plate, which is neural plate. This is neural plate. This neural plate has raised margins. Here you can see folds. These are neural folds. Neural folds. In between this folds, we have a depression. In this diagram, can you see depression? This depression is what? Neural groove. This midline depression is our neural groove. These folds fuse together and form neural tube. Am I audible? Everything is okay? Am I audible? Neural tube, right? Here you can see these folds fuse together and lead to the formation of neural tube. Now this neural tube is involved in the formation of what? Brain and spinal cord. Some cells get differentiated at the crest of neural fold. Okay. So here you can see cluster of cells. These cells get differentiated at the crest of neural folds. These cells are our neural crest cells. Neural crest cells, which get differentiated at the crest of neural folds. They further undergo differentiation and lead to the formation of different structures such as face, teeth, pigmented cells, endocrine glands, right? So neural crest cells are not only involved in the formation of tooth as well as many other structures. And they are mainly found where? In ectoderm or ectomesenchyme? We have discussed recently only. They're present where? Can anybody answer this question? Neural crest cells are present where? Mainly in the ectomesenchyme. They constitute mainly ectomesenchymal portion. So basically all the tissues of tooth are formed from ectomesenchyme except enamel, which is derived from ectoderm, right? So what is this ectoderm portion? We have discussed about ectomesenchyme, which is composed of neural crest cells. Now coming to ectoderm. What is the ectodermal portion? It is mainly primitive oral cavity. Oral cavity stomatodium, which is lined by 2 to 3 cell-layered stratified squamous epithelium. So primitive oral cavity is lined by 2 to 3 cell-layered stratified squamous epithelium. Yes, Dr. Rujira, good. You have answered it as ectomesenchyme, right? So primitive oral cavity is mainly lined by stratified squamous epithelium, which is known as ectoderm. So I think you might not be having any doubt in ectoderm and ectomesenchyme. Ectomesenchyme, by the proliferation of and differentiation of neural crest cells, and both of the interaction between this leads to tooth development. Now, initially, the primitive oral cavity is separated from the endoderm of the foregut by a buccopharyngeal membrane, right? Okay, Gayatri, neural crest cells. I think someone has doubt in neural crest cells, right? We have already discussed. This is just for your information. So what are neural crest cells and how are they formed, right? So basically, there is a thickening at the head end of the embryo, right, which is known as neural plate. This plate has what? Here you can see margins, raised margins, which are folds. These folds have midline depression, which is groove. Above that, folds will fuse together, leading to the formation of tube. And above this tube, we have condensation or differentiation of cells present at the crest of this fold, which are neural crest cells. They proliferate, they differentiate, leading to the formation of ectomesenchyme, which is further involved in the formation of rest of dental tissues, except enamel. Tanvi, all the dental tissues except enamel are formed from ectomesenchyme. So you should mark enamel as it is not formed from ectomesenchyme, right? Am I audible now? Am I audible? Okay. Primitive oral cavity is separated from the endoderm of the foregut by buccopharyngeal membrane. Buccopharyngeal membrane. So what is this buccopharyngeal membrane? It is present between the endoderm and the ectoderm. At about 27th day of gestation, that is around 4th week, what will happen? This connection will break and epithelium will come in contact with the ectomesenchyme. So basically, initially, a buccopharyngeal membrane is present between the oral cavity and the endoderm. But about 27th day, that is around 4th week, what will happen? This junction will break, leading to the connection between epithelium and connective tissue. This connective tissue will send signal to epithelium, and indirectly epithelium will send signal to connective tissue, leading to the initiation of tooth development. So at about 6 weeks, certain cells of the basal layer of the epithelium will proliferate more rapidly than the adjacent cells. Again, I am not audible. Am I audible? Okay, Nikhil. Okay, now I'm audible, right? We will repeat again. Initially, the primitive oral cavity is separated from ectoderm is separated from endoderm of the foregut by a buccopharyngeal membrane. Right. So endoderm is separated from ectoderm by buccopharyngeal membrane. But about 27 day of the gestation, that is 4th week, this buccopharyngeal membrane ruptures. It ruptures, leading to the connection between ectoderm and ectomesenchyme, which interacts and later starts tooth development. Okay. Okay, Ruhani. I will explain again. We have discussed buccopharyngeal membrane. It is a barrier between ectoderm and endoderm. But about 27 day of gestation, what will happen? This barrier will break and the ectoderm will come in contact with the ectomesenchyme, leading to the formation of tooth. So, at 4th week, around 4th week, what will happen? Buccopharyngeal membrane will rupture, and then after 2 weeks, that is around 6th week, certain cells of the basal layer, you can see this is the basal layer, this columnar cells, certain cells of the basal layer will proliferate more rapidly than the adjacent cells, leading to the formation of a thickened band. Here you can see this type of thickened band in the diagram. You can easily appreciate, right? The basal cells will proliferate, leading to the formation of a thickened band. This type of band you can see. This is our primary epithelial band. This is our primary epithelial band. Right? So, when the buccopharyngeal membrane ruptures at about 27 day of gestation, what will happen? Ectoderm will come in contact with the ectomesenchyme, leading to the initiation of tooth development. At 6th week, basal layers of this ectoderm will proliferate more rapidly as compared to the adjacent cells, leading to the formation of thickened band. Here we can see this type of thickened band. This is our thickened band. Right? This is our primary epithelial band. What is this primary epithelial band? It is horseshoe shaped, as we can see in this diagram, and mainly corresponds to the location of future dental arches such as maxilla and mandible. Maxilla and mandible. Right? Now, this primary epithelial band has mainly 2 extensions. At about 7th week, it divides into 2 extensions. Here we can see in this diagram, this is one extension, this is second extension of this epithelial band. By the proliferation of the cells, we can see the extensions, right? So, we have here 2 extensions. One extension Am I audible now, or is it breaking again? Yes, Kirti, because of the mitosis, because of increased mitosis, this neural crest cells will be proliferating more rapidly as compared to the adjacent cells, right? dental lamina and vestibular lamina. So dental lamina is mainly associated with the formation of tooth, being deciduous tooth, succedaneous tooth, and non-succedaneous tooth, right? So dental lamina is mainly associated with formation of deciduous, succedaneous, and non-succedaneous tooth. Right? And what is this dental lamina? Dental lamina is mainly a transient structure. It is a temporary structure. Transient structure. Why transient structure? Because at later stages it will disintegrate because of invagination of underlying ectomesenchyme. Here you can see this is our dental lamina. This is our dental lamina and surrounding structure is our ectomesenchymes. This ectomesenchyme will invade in later stages, leading to the separation of the enamel organ. So this is basically, this will disintegrate. This portion connecting the epithelium, this portion is our dental lamina, which will later disintegrate. So dental lamina is mainly a transient structure leading to the formation of deciduous tooth, succedaneous and non-succedaneous tooth. What is succedaneous tooth? Can anyone please help with succedaneous tooth? They are the tooth which replace the primary tooth, right? So which tooth replace the primary tooth? Permanent incisors, canine and premolars will replace the primary teeth. Right? So incisors, canine and premolars are mainly succedaneous tooth. They arise from which extension of dental lamina? This is again an important MCQ question. Which extension? Lingual extension. They arise from lingual extension of dental lamina. Which is the lingual extension? Successional lamina. Successional lamina. Yes, Dr. Ruchira, Dr. Kirti, all of you are correct. So succedaneous teeth are mainly the teeth that replace the primary tooth. And they arise from lingual extension of the dental lamina, which is known as successional lamina. This is again an important MCQ question. Again coming to non-succedaneous tooth. Which are the non-succedaneous tooth? Remaining one, our molars. Right? So molars arise from which extension of dental lamina? Distal extension. They arise from distal extension of dental lamina. This is again an important MCQ question. Yes, Mithilesh, Dr. Ruchira, Kirti, Tanvi. So they mainly arise from distal extension of dental lamina. Good. Now, in this diagram, we can see there are knob-like structures are present here. 10. The proliferation and differentiation of the cells of dental lamina leads to the formation of tooth germs for deciduous tooth at 10 different locations. Right, here we can see tooth germ present at 10 different locations. So basically these are tooth germs of what? Deciduous teeth. So here we can see this type of knob-like extension. We have at 10 different locations, which means this is the tooth germ for developing teeth, which is the enamel organ here. So basically here, because of the proliferation of the cells of dental lamina, you can see a knob-like extension at 10 different locations, which will further lead to formation of deciduous tooth. As we have recently discussed, that it is a transient structure, right? So its activity will not be permanent. It will be for only 5 years. So dental lamina will be active only for 5 years, after which it will be invaded by underlying ectomesenchyme, leading to its degeneration. During degeneration, some remnants of the dental lamina will be left behind. So they are known as remnants of dental lamina are known as stellate of Serre. Right. So after 5 years, during the disintegration, some remnants will be left behind, which are known as cell rests of Serre. Again, an important MCQ question. You can be asked, what are the remnants of dental lamina known as? Right. So for succedaneous tooth and non-succedaneous tooth, eruption formation timing are different. Tooth development timing are different. First tooth for succedaneous tooth forms in 5th month in utero, while last tooth forms during 10th month after birth. Right. So second premolar will be 10th month after birth, and first tooth will be incisor, that is 5th month in utero. While succedaneous tooth, that is our non-succedaneous tooth, that is our molars, first molar will develop 4th month in utero, second molar after birth, and third molar 5th year after birth. Right. Sumaya is asking for distal extension of dental lamina, right? So lingual extension means from here permanent tooth will erupt, and distal extension is this portion of the dental lamina where our permanent molars will erupt. This is our successional lamina, and this portion will be our, this distal extension of dental lamina is our, this is our distal extension from which molars will arise, and this is our lingual extension from which permanent succedaneous teeth will erupt. Okay. Sumaya. Now coming to vestibular lamina, right? What is vestibular lamina? Vestibular lamina is mainly present buccal to the dental lamina. Here you can see this hollow structure. This is our vestibular lamina, and this is our dental lamina. So it is present definitely buccal to the dental lamina. It is also known as lip furrow band. It is also known as lip furrow band. Now, why it is hollow? Here the cells will enlarge and the central cells will disintegrate, leading to the formation of a hollow vestibular region present between the teeth bearing region and lips and cheeks, which is our vestibule. So it leads to the formation of vestibule. It doesn't lead to the formation of any tooth structure. It leads to the formation of vestibule, right? So any doubt in this? Dental lamina and vestibular lamina, initially we had formation of thickened epithelial band, which was our primary epithelial band. This primary epithelial band had two extensions, which is vestibular lamina and dental lamina. Dental lamina leads to the formation of deciduous tooth, succedaneous and non-succedaneous tooth, while vestibular lamina leads to the formation of vestibule. Okay. Any doubt? Okay, so can we start with stages of tooth development? Right? This is the basic of our tooth development. Initially, how the tooth development is forming. Basically, it is developing by the interaction of ectomesenchyme, by the proliferation of the ectodermal cells under the influence of the underlying ectomesenchyme, leading to the formation of primary epithelial band. Okay. Bhanushri is asking about vestibular lamina. Vestibular lamina is basically an extension of primary epithelial band which leads to the formation of vestibule present between the teeth bearing region and the lips and the cheeks. In this, you can see here the cells will enlarge and then they will become hollow because of degeneration. So this region will become hollow because of disintegration, leading to an hollow appearance of the structure which is our vestibule, right? So now we will start with stages of tooth development. There are two types of stages, morphologic stages and physiologic stages. So morphologic stages are that basically they are determined on the shape of the enamel organ. Bud stage, cap stage, bell stage and advanced bell stage, right? And physiologic stages are initiation, proliferation, histodifferentiation, morphodifferentiation and apposition. Initiation stage starts at 6th to 7th week. As we have recently seen, what was happening in this 6th to 7th week? Can anyone answer this? What was happening during the 6th to 7th week? Cells were proliferating, leading to the formation of band, primary epithelial band. So after that, again the cells will proliferate and they will form a bud-like structure. So based on the shape of the enamel organ, this ectodermal portion is our enamel organ. This is our enamel organ. So definitely this enamel organ will lead to the formation of enamel in future, right? And surrounding this we have our ectomesenchyme, which will further lead to the formation of other dental tissues. So these stages are named mainly on the shape of the enamel organ formed by the proliferation of the cells, basal cells. So bud stage is formed during 8th week, cap stage 9th to 10th week and bell stage 11th to 12th week. Here in this diagram also you can appreciate this is bud stage, then we have cap stage, then we have bell stage, right? Then dentinogenesis meaning formation of dentine, then amylogenesis meaning formation of enamel, then crown formation, root formation. So these are different stages of tooth formation. Starting with the bud stage. So in this diagram, again, this is very important image based question, can be asked from tooth development. So you can be thorough with this histologic images also. Here you can see bud stage, bud shaped enamel organ, right? We have two layers here. Peripheral layer and central layer, right? Peripheral layer, that is the outer layer having low columnar cells, and centrally we have what? Polygonal cells. So in bud stage, mainly what will happen? The enamel organ is having a bud shape and this enamel organ has two layers. Here also you can appreciate the two layers. This is one layer, outer layer. Yes, the dental lamina, proliferation of the cells of the dental lamina. Here we can see this is our enamel organ. Ankita is having a doubt, right? This is basically the extension into the ectomesenchyme. This connecting link is our dental lamina. And their cells are proliferating, the primary epithelial cells are proliferating, leading to the formation of enamel organ. This whole portion is our enamel organ. enamel organ, right? So here the enamel organ has two layers of cells, outer low columnar and central polygonal cells. There is condensation of ectomesenchymal cells. Here you can see just adjacent to the enamel organ, there will be ectomesenchymal cells, condensation or differentiation of ectomesenchymal cells. This is our what? Dental papilla. Dental papilla. And again there will be condensation of the cells surrounding enamel organ as well as dental papilla, which will be our dental follicle. Dental follicle or dental sac. Dental sac. Right. So mainly this forms tooth gum. These three structures form tooth gum. So which three structures form tooth gum? Enamel organ, dental papilla, and dental follicle, right? Or dental sac. So what is enamel organ? It is mainly involved in the formation of enamel, and here we can see it is mainly formed by the proliferation of the ectodermal cells. These are our ectodermal cells which form the enamel organ. And mainly here in birth stage we have two layers, right? Outer columnar and central polygonal. Then surrounding the enamel organ we have condensation of ectomesenchymal cells which are dental papilla. Here you can easily appreciate dental papilla. This is our dental papilla. And surrounding this enamel organ and dental papilla we have dental sac. This portion is our dental sac, right? So tooth gum basically consists of enamel organ, dental papilla and dental sac. Enamel organs give rise to enamel. Dental papilla, remember D and P, dentine and pulp. Dental sac, cap, C-A-P. C, cementum. A, alveolar bone. And P, periodontal ligament. D and P, dentine and pulp. Right? So, mainly this is very important here. Enamel organ, dental papilla and dental follicle or dental sac which gives rise to dentine and dental papilla D and P, dentine and pulp, and dental follicle or dental sac cap, cementum, alveolar bone and periodontal ligament. So this is our tooth gum mainly. Enamel organ, dental papilla and dental sac. Now coming to our next stage. Which is the next stage here? Cap stage, right? Any doubt in birth stage now? Coming to cap stage. Here we can see we have a shape of cap, right? So again enamel organ is developing a shape of cap because of the proliferation of the ectodermal cells. In this diagram, we can appreciate different types of cells, right? So here we will be having three layers mainly. In birth stage, we were having two layers. So which three layers will be present here? Outer enamel epithelium, inner enamel epithelium and stellate reticulum. Right? So outer enamel epithelium, inner enamel epithelium, and stellate reticulum. Outer enamel epithelium is mainly present in the convexity of the cap, and here we will be having cuboidal cells. Here you can see cuboidal cells. Here cuboidal cells are present. Here we can easily appreciate the presence of cuboidal cells, right? So this is our outer enamel epithelium present in the convexity of the cap. Now coming to concavity of the cap. This is our concavity. So here we have tall columnar cells present. These are our tall columnar cells. Right? So this tall columnar cells are our inner enamel epithelium present in the concavity of the cap. And central cells, here we can see the central cells, they are star shaped, right? Initially in the birth stage we had seen polygonal cells, but here we are seeing star shaped cells. So why star shaped cells here? These star shaped cells are mainly stellate reticulum cells. So initially the central polyhedral cells synthesize glycosaminoglycans. Glycosaminoglycans, which are released in the extracellular compartment. These glycosaminoglycans are mainly hydrophilic. They are hydrophilic, water loving, right? So they will absorb water through osmotic force from the surrounding ectomesenchyme. So they will absorb water from the surrounding ectomesenchyme through osmotic force, leading to the separation of the cells. The polyhedral cells will start moving away from each other because of the water content. But to maintain contact, these cells will form a network, a star-shaped network. So to maintain contact with each other, they will form a star-shaped network, which is known as stellate reticulum, right? So they will form a star-shaped network, that is stellate reticulum. This stellate reticulum has mucoid material which is rich in albumin. So it also contains a mucoid material. Mucoid material which is rich in albumin. It will act as a shock absorber. It will provide a cushion-like consistency and protects the underlying enamel forming cells. It has a mucoid material which acts as a shock absorber. Shock absorber. Right? So I think you might not be having any doubt in cap stage. Again, this is an image-based question also. You can be shown this type of diagram and asked to identify the stage of tooth development. So this is mainly cap stage. Why? Because here also we can see the cells which are present in the convexity. Here we can see again the cells which are present in the concavity and central cells which are star-shaped, right? So here enamel organ is having 3 layers. Now again surrounding the enamel organ we can see the condensation of the ectomesenchymal cells which is dental papilla, and surrounding both enamel organ and dental papilla what will be present? Dental sac or dental follicle, right? So this portion is our dental sac or dental follicle. Just next to the enamel organ we have dental papilla, and this is our enamel organ. Okay, any doubt in this? So this star shaped network that is present in the cap stage is what? Anyone can answer? Here, the star shaped network is what? Anyone can answer? Yes, stellate reticulum, and its function is mainly providing cushion-like consistency and protecting the underlying enamel forming cells. Okay. So I think you all have understood this. Now coming to the transient structures present during the cap stage. Recently in NEET there was a question on enamel knot, right? An image-based question was asked. So again, this is very important. Transient structures. Transient meaning temporary structures that is present only during the cap stage, that are present before the enamel formation. They will disappear after enamel formation. Right? So which are the transient structures during cap stage? Enamel knot, enamel cord, enamel septum, and enamel navel. Be thorough with the diagram. Here you can see cluster of cells present just next to the inner enamel epithelium. This is our enamel knot. This is our enamel knot. So this was a recent question. This type of diagram was asked. This cells are what? This transient structure present in the cap stage is what? So this is mainly enamel knot. Enamel knot is mainly cluster of cells present near the concavity of the cap, projecting towards the dental papilla. This is our enamel knot. It has two functions. Mainly it acts as a reservoir of dividing cells, and it acts as a signaling center and plays an important role in determining the shape of the tooth. So mainly enamel knot is involved in what? Division of the cells. It acts as a signaling center for growth of the cells, as well as it helps in determining the shape of the tooth. Right? Then coming to enamel cord. What is enamel cord? Vertical extension of enamel knot. You have chargers, right? So we have cord of charger. What is cord? It is an extension. Same way, vertical extension of enamel knot is our enamel cord. This is vertical extension, which is our enamel cord. So vertical extension of enamel knot running across the center of the enamel organ is our enamel cord. So in this diagram we can appreciate here we have knot, then we have vertical extension is our cord. This is our cord. Enamel septum. What is enamel septum? When enamel cord meets the outer enamel epithelium. So definitely here we have outer enamel epithelium, right? So when enamel cord meets the outer enamel epithelium, it is enamel septum. The point at which the cord meets the outer enamel epithelium is our enamel septum. And at this meeting point, there is a depression present, which is known as enamel navel. A small depression is present at this junction, which is enamel navel. So, any doubt in this transient structures? You can be asked an image-based question also or an MCQ question from this transient structures also. These transient structures, they are not present in bell stage or bud stage. They are present only during the cap stage before the enamel formation. Okay, Tanya. Enamel cord is mainly vertical extension of enamel knot. In this image, if these are the cluster of the cells, this is enamel knot, right? Their extension is enamel cord. This is enamel cord. Right? Okay, Aditi. Enamel septum in the image, right? Enamel septum is here. Here you can see this blue point where the enamel cord meets the outer enamel epithelium. It is enamel septum. This blue point where the cord meets the outer enamel epithelium. Any doubt in this? Mainly enamel cord and enamel knot are involved in determining the shape of the tooth. Rest are the transient structures that are formed during the proliferation of these cells. Okay. So now we will be discussing about bell stage, right? Coming to bell stage. Okay, Abhishek is asking about enamel navel. Enamel navel is small depression which is present at the junction of this. So here during the junction we will have a small depression present, just like our navel. So it is named as navel. Enamel niche again. Okay, Vidu, she is asking about enamel niche. It is mainly apparent during the sectioning artifact, right? Enamel niche is double attachment of the dental lamina and underlying ectomesenchyme. That is enamel niche. Navel we have discussed, Abhishek. The point at which enamel cord meets the outer enamel epithelium is septum, and at that point of meeting we have a small depression just like navel, which is enamel navel. Now coming to bell stage. Here you can see something is missing. What is missing here? Can anyone appreciate from the above diagrams? Here we have connecting link with the upper epithelium, right? Here you can see it is also a connecting link of here with the epithelium. So this is our what? Dental lamina. So what is missing here in this diagram? Can anyone appreciate? Can anyone appreciate what is missing here? Anyone? Here there is disintegration of dental lamina. Dental lamina is absent here. We have already discussed dental lamina is a transient structure, right? It is mainly a transient structure. So during the bell stage, we can see there is disintegration of dental lamina. Yes, Mithilesh, Riya, Priyanka, all are correct. So here, dental lamina is disintegrating during the Bell stage. So first point is disintegration of dental lamina. Now, what things you can appreciate here? We have how many layers present here? From the diagram, we have outer enamel epithelium, we have inner enamel epithelium, and this is our inner enamel epithelium. Okay, I will make a diagram again for this so you can easily appreciate the layers. Yes, Ruchira is correct. There are 4 layers. This is our one layer having cuboidal cells. Which layer is this having cuboidal cells? Then we have tall columnar cells. This is our outer enamel epithelium. Tall columnar cells, we are having inner enamel epithelial layer. Above this inner enamel epithelial layer, we have one more layer. Flattened cells will be present. Flat squamous cells we can appreciate here. These are our stratum intermedium. Stratum intermedium. You can see this flattened cells. They are stratum intermedium. Right, and just above the stratum intermedium we will be having star shaped cells, which are our stellate reticulum like cells. Okay, so mainly we have 4 layers here. Stellate reticulum. Okay, so all of you are correct. I think you are getting this now. So mainly 4 layer. Outer enamel epithelium, stellate reticulum, stratum intermedium, and inner enamel epithelium. So here also you can easily appreciate outer enamel epithelium. This is our stellate reticulum. Just next to the stellate reticulum we have stratum intermedium, and this all columnar cells are our inner enamel epithelium. Right. So layers, I don't think you might be having any doubt. Now, a basement membrane is present between the inner enamel epithelium and dental papilla. Right? Here. This purple line, can you appreciate? This is our basement membrane. And just next to that, we have our ectomesenchyme, which is our dental papilla. Right? So here we have our dental papilla, and this purple line here also, or the light blue line, can you appreciate here? This is our basement membrane. This basement membrane is separating the inner enamel epithelium from the dental papilla. It is known as membrana preformativa. Membrana preformativa. So basement membrane present between what? Inner enamel epithelium and dental papilla is known as what? And even we have recently discussed, it is known as what? Membrana preformativa. Preformativa. This can come as an MCQ question. What is membrana preformativa? Important MCQ question. It forms a blueprint for determining the shape of the crown. Right? So this is membrana preformativa. Basement membrane between inner enamel epithelium and dental papilla. Any doubt in this? Now coming to next structure, which is cervical loop. Here we can see the end part of the enamel organ. Yes, Kirti. In morphologic stages, we are mainly seeing the changes in the enamel organ due to the proliferation of the cells. The layers we are seeing from bud stage, cap stage, bell stage, they are the layers present in the enamel organ only. Surrounding that, we have ectomesenchyme, that is dental papilla and dental sac. All this is happening in enamel organ. Just as you are studying different subjects for your NEET entrance exam, right? Stage by stage, one by one, one more subject is adding to your list. Same way, one more layer is adding to the enamel organ, right? As it is advancing towards the formation of the tooth, towards the formation of the crown, towards the formation of the root, different layers are having their different functions. So, coming to the cervical portion of the enamel organ. Here you can see the end point of the enamel organ. This is our cervical loop. Cervical loop. Right? The end portion of the enamel organ is our cervical loop. This is our cervical loop. This cervical loop is having only two layers, inner enamel epithelium and outer enamel epithelium. No other layer, no stratum intermedium, no stellate reticulum, only two layers, outer enamel epithelium and inner enamel epithelium. Right? Only two layers are present in the cervical loop. Inner enamel epithelium plus outer enamel epithelium. And this leads to the formation of root. It helps in the formation of root. Right? So we have seen what? Disintegration of dental lamina in early bell stage. Then we have discussed about the four layers. Then we are discussing about the membrana preformativa, cervical loop. Okay, we have missed discussing about stratum intermedium here, right? Stratum intermedium. What is stratum intermedium? This is an extra layer we are seeing after cap stage. So what is stratum intermedium? It is mainly made up of flattened squamous cells. It is present between where? Stellate reticulum and inner enamel epithelium. It is mainly associated with synthesis of proteins. Mainly associated with synthesis of proteins, and it helps in transport of nutrients. So what is the function? So what will be the function of stratum intermedium indirectly? It is associated with protein synthesis and transport of nutrients, right? Transport of nutrients to what? Transport of nutrients to inner enamel epithelium. And this inner enamel epithelial cells are our cells which will differentiate into amyloblast cells and they will form enamel. Okay. So stratum intermedium is mainly associated with protein synthesis and transport of nutrients. They are transporting nutrients to the surrounding inner enamel epithelial cells. So as they are providing nourishment to inner enamel epithelial cells, indirectly they are helping in the formation of enamel, because in later stages this inner enamel epithelial cells will differentiate into amyloblast cells from the word itself, all the blast cells are involved in the formation, and amylo meaning enamel forming cells. So they are helping in formation of enamel by providing nourishment to the enamel forming cells. Yes, and they are high in alkaline phosphatase activity. They have increased alkaline phosphatase activity. Right. So we have discussed about stratum intermedium as well. Right. So stratum intermedium mainly helps in formation of enamel by providing nourishment to the inner enamel epithelial cells. Okay, so someone had doubt regarding the cervical loop, right? Significance of cervical loop. So we have discussed, right? What is the significance of cervical loop? What its role? Anybody can answer this again? Cervical loop is involved in formation of what? Here we can see cervical loop. This will proliferate and further lead to the formation of root. Yes, Mithilesh. HERS, which is involved in the formation of root. Good. Gayatri, Munaza. Yes. Saptrishi, Amrita. Okay. So this we are discussing about early bell stage. Here, any hard tissue formation we have reached? No. Till now, we are not discussed about any hard tissue formation. Okay, one more point here is remaining, that is reversal of polarity. What is reversal of polarity? Here, the inner enamel epithelial cells, we will have reversal of polarity in inner enamel epithelial cells. What is reversal of polarity? That is nucleus move away from the basement membrane. Here, this is reversal of polarity. Initially, it will be present at the basement membrane, but in case of reversal of polarity, when it becomes metabolically active, there will be reversal of polarity. So one more point, as this cells further differentiate, before the differentiation into amyloblast, there will be reversal of polarity in inner enamel epithelial cells. Right? So any doubt in this? Advanced Bell stage? Main points we have already discussed: disintegration of dental lamina, cervical loop, then membrana preformativa, the stages, stratum intermedium, and reversal of polarity. But no hard tissue formation in early Bell stage, remember. So if this type of diagram is given, don't confuse it with advanced Bell stage. Hard tissue formation will be seen only in advanced Bell stage. Okay. Priyanka is asking, what is zone of reflection? Right. Cervical loop is also known as zone of reflection. The other name for cervical loop is zone of reflection. Zone of reflection. So cervical loop is also known as zone of reflection. So if MCQ question comes, what is zone of reflection? Don't get confused. You can mark it as what? Cervical loop. Right. So we have discussed about Bell stage. Now coming to advanced Bell stage. What will happen in advanced Bell stage? Here again we cannot see any dental lamina, so already dental lamina has disintegrated. Now next stage, what we are appreciating here, can anyone say? Hard tissues, right? Enamel, dentine. So we can see there is enamel formation also, there is dentine formation also. So hard tissue formation, here you can see the formation of hard tissue. So mainly in advanced Bell stage, we will be discussing about the formation of enamel and dentine. So which cells will form enamel? amyloblast cells. And which cells will form dentin? Odontoblast cells, right? Okay. So we will start with first advanced Bell stage. What will happen? Under the influence of inner enamel epithelial cells, which have undergone what? Reversal of polarity, right? Already they are active, metabolically active. What will happen? The outermost cells of dental papilla will differentiate into odontoblast. Again, there is a blast. Blast means formation. Odonto meaning dentin formation. So here we can see these cells. These are our dental papilla cells which have differentiated into odontoblast. Can you appreciate the odontoblast cells here in this diagram? Yes. Right. So under the influence of inner enamel epithelial cells, this is our dental papilla, right? So here the dental papilla cells will differentiate into odontoblast cells. And here we have our inner enamel epithelial cells, tall columnar cells. Okay. Under the influence of these tall columnar cells, dental papilla cells are differentiating into odontoblast cells. This red cells you can easily appreciate here. These are our odontoblast cells. This odontoblast cells leads to the formation of dentin. Okay. So this odontoblast cells will form dentin. Once dentin is formed, what will happen? Here we can see the formation of dentin. What will happen? Initially the nutritional supply was from dental papilla. But once a hard tissue is formed, there will be a barrier. There will be a break in nutritional supply to the inner enamel epithelial cells, right? So once dentin is formed, what will happen? Nutritional supply from the dental papilla will be cut off, right? So once dentin is formed, nutritional supply from dental papilla will be cut off. So now, from where the inner enamel epithelial cells will get nourishment? Can anyone say? We have one more ectomesenchymal structure here. Which is that structure which can provide nourishment? In tooth germ, we have enamel organ, dental papilla and dental sac, right? So now the nourishment will be from which structure? Yes, Divya, you are correct. Stratum intermedium will be providing nourishment, but stratum intermedium is a mediator. It will also require nourishment from somewhere. So from where will we get nourishment? Yes, Bindu, Ambika, Pavan, dental follicle or dental sac. So where is dental follicle present? Here, right? This is our dental sac or dental follicle. So from this dental sac or dental follicle, what will happen? Nourishment will be provided to the inner enamel epithelial cells, right? So for this, what will happen? Here we can see initially the outer enamel epithelium was smooth, but once the nutritional supply is cut off, it will be laid down in folds. This type of folds. Outer enamel epithelium will be laid down in folds. So once nutritional supply is cut off, outer enamel epithelium will be laid down in folds. And what will happen next? stellate reticulum will disintegrate. There will be disintegration of stellate reticulum. Stellate reticulum will disintegrate. So here stellate reticulum will disintegrate. So directly what will happen? Nourishment will come to stratum intermedium and it will provide to inner enamel epithelial cells. Right? And then what will happen next? Inner enamel epithelial cells will differentiate into amyloblast cells and they will start forming enamel. Inner enamel epithelial cells will differentiate into amyloblast cells and they will form enamel. So you can see what is happening here. First, which dental tissue is forming, enamel or dentine? Which dental tissue is forming? Enamel or dentine? Dentine, right? Here we can see inner enamel epithelium is providing signal to dental papilla to differentiate into odontoblast cells. So basically inner enamel epithelium is signaling dental papilla cells. Dental papilla cells are forming dentine. Once dentine is formed, then this dentine is again giving signal to the inner enamel epithelial cells to differentiate into amyloblast cells and form enamel. So both of them, this formation of enamel and dentine is interdependent. It is not independent. Without inner enamel epithelial cells, odontoblast cells cannot be formed, and without dentine, enamel cannot be formed, right? So this formation is what? Reciprocal induction. Right? So this formation of dentine and enamel is what? Interdependent. And it is known as reciprocal induction. Same as our relation, right? Your dedication, your efforts and our guidance leads to your success, right? So this is reciprocal induction. Any doubt in this? This is very important. This type of diagram can be asked as an image-based question. So first you should identify the formation of hard tissues, whether enamel is formed or whether dentine is formed. And here we have what? Mainly formation of enamel and dentine. Under the influence of inner enamel epithelial cells, dental papilla cells are differentiating into odontoblast, forming dentine. Once dentine is formed, nutritional supply is being cut off and it is coming from dental sac, as a result of which dental outer enamel epithelium will be laid down in folds. And there is disintegration of stellate reticulum in advanced Bell stage. Stellate reticulum, no, dentine formation is taking place before. After that, nutritional supply is being cut off and then stellate reticulum is disintegrating. Right, Pawan? Now coming to root formation. Any doubt in this? So which cells form enamel? Which cells form enamel? Okay, all of you are willing to take a break. After break, Can we start with root formation, or shall we complete root formation first? Okay, all of you are correct. Mantle amyloblast cells. Okay. So shall we complete with the root formation, or do you want a break? Kirti is um, okay, 50-50 responses. But we are about to complete, right? We can have root formation, then we can take a break. We are about to complete, right? 10 more minutes. Root formation is easy. It's okay, Kirti. And okay, we can complete with root formation and then we can have a break. Okay, in root formation, what is involved in root formation? We have already discussed. Cervical portion of enamel organ, that was cervical loop. Cervical loop was having what? Which layers? Only two layers, inner enamel epithelium and outer enamel epithelium, right? This cervical loop cells proliferate, leading to the formation of HERS. Shubham, Riya, we will complete root formation and we will have a break, okay? Sure. Okay. So this proliferation of inner enamel epithelial cells and outer enamel epithelial cells lead to the formation of HERS, that is Hertwig's epithelial root sheet. Hertwig's epithelial root sheet. This Hertwig's epithelial root sheet mainly determines the shape, number and size of roots. It separates the dental papilla from the dental sac. Here you can see, this is our dental papilla here, and here there will be dental sac, and this is our Hertwig's epithelial root sheet. Right? Now, there is no stratum intermedium here. So definitely there will be no inner enamel epithelial cells will not be getting any nourishment, and there will be no enamel formation here. So in root, we have only dentin formation, right? Under the influence of this inner enamel epithelial cells, as we have recently discussed in advanced Bell stage, what is happening? This dental papilla cells will differentiate into odontoblast cells. Odontoblast cells will start forming dentin. Once dentin is formed, what will happen? There will be disintegration of HERS. There will be disintegration of HERS. Dentin. Then there will be disintegration of HERS. Once there is disintegration of HERS, what will happen? Here we have dental sac cells, right? Dental sac cells will directly come in contact with the form dentin. So here continuity of HERS is break. So dental sac cells will have a pathway to come in contact with the form dentin. Right? This dental sac cells will differentiate into which cells? We have discussed in earlier slides, right? Dental sac cells will differentiate into which cells? Dental sac forms what? Cap, cementum, alveolar bone and periodontal ligament. So this dental sac cells will differentiate into cementoblast, which cells form bone? Osteoblast and fibroblast. Right? Cementoblast will lead to the formation of cementum, cap, always remember cap, osteoblast, bone, and fibroblast, PDL. Right? Okay. So this is our basically root formation. In root formation, we have proliferation of inner and outer enamel epithelial cells leading to the formation of HERS. Under the influence of inner enamel epithelial cells of HERS, dental papilla cells are differentiating into dentine. Once dentine is formed, what is happening? There is a break in HERS, as a result of which the dental sac cells are directly coming in contact with the dental papilla cells. Here, this is dental papilla, this is dental sac. And if there is a break here, then dental sac cells will directly come in contact with the formed dentine, leading to the formation of cementoblast forming cementum, osteoblast forming bone, and fibroblast forming PDL fibers. Right? So this is root formation. Now, as HERS is disintegrating, again there are some remnants of HERS left behind. So remnants of HERS are known as, this is again an MCQ question. Remnants of HERS are known as, what remnants of HERS are known as? Cell rests of molasses. Cell rests of molasses. Cell rests of molasses. This is again an important MCQ question. We have seen cell rests of serrae, which are remnants of dental lamina. Now we are discussing about remnants of HERS, which are cell rests of molasses. They are mainly present in PDL. Right? Okay. Ruchira is asking about epithelial diaphragm, right? Yes. There's a sharp band, as you can see here, a horizontal band. Here we can see there is a sharp band, horizontal extension. During the proliferation, there will be a sharp horizontal extension of the cells. This horizontal band is our epithelial diaphragm. This is our epithelial diaphragm. This is our epithelial diaphragm. This sharp band that is present during the proliferation of the cells, this band is our epithelial diaphragm. Here you can see this band. This is our epithelial diaphragm. It leaves a blueprint for future cemento-enamel junction. Cemento-enamel junction. Right? Now, as we have seen in roots, right? Here we have seen there is a gap present between the roots. Okay. So, again, with the proliferation of this HERS and surrounding ectomesenchymal cells, dental papilla and dental sac cells, this space will be filled and there will be a cone-shaped root present. Okay. This is for single rooted tooth. Now coming to multiple rooted tooth, right? What will happen in case of multiple rooted tooth? Tongue-like extensions are present. If in case of maxillary molars, we will have 3 tongue-like extensions similar to the proliferation of single rooted teeth. Same way for 3 roots, we have the same pattern. Proliferation of HERS, then dentine formation from dental papilla, disintegration of HERS, each for different extensions, tongue-like extensions. Okay. So for multiple teeth, based on the number of roots, there will be tongue-like extensions, and from this extensions, again, there will be proliferation of HERS. So this chart is very important. Be thorough with this chart. Tooth gum. We have already discussed tooth gum is composed of what? Can anyone say? Tooth gum basically is composed of three structures: enamel organ, dental papilla, and dental sac. Right? Enamel organ, dental papilla, and dental sac. Enamel organ contains what? That leads to the formation of enamel? Inner enamel epithelial cells. That lead to the formation of enamel. This enamel epithelial cells will differentiate into which cells? Ameloblast cells. So here you can see enamel organ is having inner enamel epithelial cells which will differentiate into ameloblast cells, leading to the formation of enamel. Coming to dental papilla. Dental papilla will form dentine and pulp. Dental papilla will differentiate into odontoblast cells that will form dentine. And dental follicle, you can see cap. Cementoblast, fibroblast, and osteoblast that will lead to the formation of cementum, PDL, and alveolar bone. Right? So this chart is also very important. Tooth gum composed of three enamel organ, dental papilla, and dental sac. Enamel organ leads to the formation of enamel, and dental papilla, dentine and pulp. Dental sac, cap. Ameloblast, inner enamel epithelial cells differentiate into ameloblast cells that form enamel. Dental papilla cells differentiate into odontoblast that form dentine. And the first formed dental tissue is dentine. Always remember this. Right? Genes involved in tooth development. Mainly limb homeobox genes, LHX6 and LHX7. Fibroblast growth factor 8 is mainly present in the epithelium, and the LHX genes are mainly present in the ectomesenchyme. Position of the tooth germ in epithelium: FGF8, BMP4, and PAX9 in mesenchyme. Tooth type determination. So what is tooth type determination? We have anterior tooth only in the anterior region, posterior tooth in the posterior region. How is this possible? This is known as tooth patterning, right? This is mainly patterning, determination of specific tooth type at a correct location. We don't have incisors in the posterior region or molars in the anterior region, right? So this is patterning. It has two theories: field model theory and clone model theory. According to field model theory, factors responsible for determination are present already within the ectomesenchyme. And clone model theory, under the influence of the epithelium, the ectomesenchymal cells will program together and produce a given pattern. So in field model, already ectomesenchymal is having factors responsible for the determination. In clone model, under the influence of epithelium, the ectomesenchyme will be prepared for determining the pattern. So also remember this also. DLX1, DLX2 and BARX1 for posterior region, MSX1, MSX2 and DLX2 in the anterior region. Right? Okay. So this we have completed. We have left with the clinical considerations only now. Do you want this or after break? Lack of initiation. What is initiation? Proliferation of the cells. If proliferation doesn't happen, primary epithelial band will not be formed. If primary epithelial band is not formed, dental lamina will not be formed. And if dental lamina is not formed, what will not happen further? any dental tissue will not be formed, right? Okay, so all of you are saying we'll discuss clinical considerations after the break, right? Okay. So we'll discuss this after break. We'll meet after 10 minutes break or 15 minutes break. Okay, Ria. We are having break now. We'll meet after 10 minutes, right? Okay. We'll meet after 15 minutes. All of you are saying 15 minutes. Have break, have water, have some food. We'll meet after that. Thank you. It was a good interactive class, right? All of you are answering. Nice to see that. Okay, we will